Have you ever had a headache from toothache and wondered, how can one bad tooth make my whole head hurt? It sounds strange at first, but it happens more often than people realize. A problem that starts deep inside one tooth can spread pain into your jaw, ear, temple, cheek, and even the side of your head. And that's why many people get confused. They treat the headache, but the real problem is sitting quietly inside the mouth. So what is headache from toothache? Who gets it? When should you take it seriously? Where does the pain actually travel? Why does it happen? And how can you tell if your tooth is the real cause? In this video, we'll break it down in simple language. No complicated dental lecture, no overly technical talk. Just the symptoms, patterns, and warning signs that matter. We'll also cover when it might be something small, when it might be infection, and when you really should not wait. Stay until the end, because the last part could help you avoid ignoring a dental problem that only gets worse with time. Tooth problems can cause pain in or around a tooth, and infection or abscess may spread pain and swelling into nearby tissues. Severe or persistent pain usually needs dental treatment. So, what actually causes a headache from toothache? In many cases, it starts with a dental problem like a cavity, inflamed nerve, cracked tooth, gum infection, or abscess. Who is most likely to feel this? Anyone with untreated decay, broken fillings, grinding habits, gum disease, or poor dental care over time. Why does a tooth affect the head? Because the mouth, jaw, face, and head share nerve pathways. When one tooth becomes deeply irritated or infected, your body may not keep the pain in one place. Instead, the pain can spread or feel like it's radiating upward. Where do people feel it most? Often in the jaw, ear area, temple, cheek, around the eye, or on one side of the head. When does it get worse? While chewing, lying down, drinking something hot or cold, or when the inflammation has been building for days. How can you suspect the tooth is involved? If the headache seems to match tooth sensitivity, jaw soreness, gum swelling, or a clear bad tooth on one side. Untreated cavities can lead to serious toothache, infection, and tooth loss, while tooth abscesses often result from untreated decay, injury, or prior dental work. Now here's the part that surprises most people. The pain is not always felt exactly where the problem is. What is happening? This is often called referred pain. That means your brain may interpret irritation from a tooth, gum, or jaw area as pain somewhere nearby, like the temple, ear, or side of the head. Why does that happen? Because nerves in the face and jaw are closely connected. Who notices this most? People with lower molar problems, wisdom tooth issues, jaw clenching, or nighttime grinding. Where can the pain travel? Into the ear, around the joint in front of the ear, into the cheek, and up into the head. When is it worse? Often after chewing, waking up from sleep, or during stressful periods when clenching increases. How do you tell the difference? If the headache comes with sore teeth, jaw tightness, pain when biting, or tenderness near the jaw joint, the mouth may be involved more than you think. That's why pain location alone can mislead you. Jaw pain can come from toothache, gum disease, or teeth grinding, and it may affect the area around the ears and significantly affect quality of life. This is where you need to pay close attention. When does headache from toothache become more than just irritation? When infection enters the picture. What are the clues? Throbbing tooth pain, swelling in the gums or face, bad taste in the mouth, sensitivity when biting, fever, or pain that seems to pulse and spread. Why is this important? Because a tooth abscess is not just a bad tooth, it is a bacterial infection, and without treatment it can spread to surrounding bone and nearby tissues. Who should be especially careful? Anyone with facial swelling, fever, worsening pain, or a visible pimple, like bump on the gum. Where does the danger show up first? Often around the root of the tooth, the gum, cheek, or jawline. How fast should you act? Don't wait and hope it settles if swelling or fever is involved. Painkillers may dull the symptoms, but they do not remove the infection. This is one of those situations where the headache may be your body's way of saying the dental problem is getting deeper. A tooth abscess is a bacterial infection that causes a pocket of pus. Symptoms can include severe toothache, swollen gums, and fever, An untreated infection can spread to surrounding bone and tissues. Not every headache from toothache comes from a cavity or abscess. What else can trigger it? A cracked tooth, exposed nerve, gum disease, impacted wisdom tooth, or heavy clenching and grinding. Even sinus inflammation can confuse people, especially because upper back teeth sit close to the sinuses. Who gets mixed signals the most? People with upper molar pain, facial pressure, jaw tension, or habits like grinding during sleep. Why does this matter? Because if you assume it's just a headache, you may miss the real cause. Where do people feel this overlap? In the cheeks, upper jaw, around the eyes, or across one side of the face? When should you suspect something other than a simple cavity? If the tooth hurts only when biting a certain way, if your jaw feels stiff, or if you wake up with soreness even before eating. How do you think clearly about it? Look for patterns. Tooth sensitivity, jaw tension, gum bleeding, or pain in upper back teeth can point the investigation in different directions. Sinus inflammation can cause pain in the upper rear teeth because they are close to the sinuses, and jaw pain may also be linked to grinding or toothache. So how should you handle a headache from toothache? First, do not keep guessing for too long. What can you do right away? Pay attention to the exact tooth or side involved. Avoid chewing on that side. Rinse gently and arrange a dental evaluation if the pain is persistent or severe. Who should seek help sooner rather than later? Anyone with swelling, fever, a bad taste from possible drainage, severe pain that does not settle, or pain that keeps returning. Why not just rely on home remedies? Because dental problems such as cavities, cracks, infections, and abscesses usually do not fix themselves. When does it become urgent? If the pain is intense and nonstop, your face is swelling, or you feel unwell with fever. Where should you go? Your dentist, an urgent dental service, or emergency care depending on severity and access. How do you make the appointment more useful? Note when it started, what makes it worse, and whether heat, cold, chewing, or lying down changes the pain. The NHS advises seeing a dentist for toothache. And urgent dental care is recommended for severe toothache, swelling, or infection-related symptoms such as fever. So here's the key message. Headache from toothache is real, and it's often your body telling you that the problem is bigger than just a sore tooth. What could be behind it? A cavity, a cracked tooth, gum disease, jaw tension, grinding, or even a spreading infection. Who should pay extra attention? Anyone with one-sided facial pain, repeated headaches linked to chewing, swelling, fever, or pain that keeps coming back. When should you stop waiting? When the headache and tooth pain are worsening, interrupting sleep, or showing signs of infection. Why does this matter? Because dental pain tends to get more expensive, more painful, and harder to treat when ignored for too long. How should you use this video? As education and awareness, not as a diagnosis. If this video helped you understand headache from toothache, subscribe to the channel and leave a comment sharing your experience or suggesting the next health topic you want covered. Your comment could help someone else connect the dots before their small tooth problem becomes a much bigger one. Disclaimer: this video is for educational purposes only and is not a substitute for professional medical or dental advice, diagnosis, or treatment. If you have severe tooth pain, facial swelling, fever, or symptoms that are getting worse, seek prompt dental or medical care.